Hi, I'm Dr. Richard Greco from the Georgia Institute for Plastic Surgery. We're going to introduce you to a segment about how to age gracefully. Today you're going to meet many patients with many different stories. Some of the stories that I've seen over the years are pretty amazing.
I wanted to do it just for myself because, I wanted to keep looking good.
So you go on vacation, look at pictures, and you go, who are those people? And it's not something that you necessarily see. So I think that's revealing, and you want to get something done about it. And of course, I've always known about plastic surgery because I deal with it in my day-to-day life and see the results of plastic surgeons and know that it's a safe and viable alternative for people.
It took a lot of years off my life, plus made me feel better about myself.
I'm very pleased with it. I'd do it again.
The main motivation was I just wanted to look fresh.
We're going to introduce you to multiple patients who've undergone the journey to look as good as possible. We will have treated them with both operative and non-operative techniques. You'll meet some patients who've had fillers, Botox, facelifts, eyelid lifts. Each of these are geared and focused to this patient's specific problems. We want you to look as good as you can. I hope you learn from our patients' experiences.
My whole experience at this facility was very positive. I never felt pressured. The first thing they did, they were very smart. They put me in Dr. Greco's office, and I went in the room, and there were all these books, and I was there for about 20 minutes, and I went through all of these books, and I was amazed. In fact, one of the women I just met was in that book, and I remembered her from the picture because it was absolutely amazing what they were able to do.
My first time was in 2012. In 2008, my husband was in the Savannah sugar refinery explosion, and he lived a week at the burn center in Augusta. And so he died on Valentine's Day. And so I guess for about 3.5 years, I just cried a lot. So someone had recommended Dr. Greco, and I came here and he changed my life, my eyes. Of course, when you cry, you have big bags. But he did. He took a lot of years off my life, plus made me feel better about myself. I lost over 100 pounds. So I had a lot of loose skin that he kind of fixed for me. I was able to see results immediately, within a couple of weeks. The first week, of course, is really rough. You're sore. But I was just, like I said, he changed my life. And it wasn't too pretty like the first week. But, there's some bruising. But, after about 2 weeks, it was like I felt like a whole different person.
Well, the first thing we're going to do is evaluate the area around your eyes. Sometimes it's because your brow is sagging too much. Sometimes it's because you have loose skin hanging over your eyelashes. Sometimes it's because you have a lot of puffiness to your lower eyelids. Some people tell me I look like I have my bags packed and I'm ready to go. That really just means they have a lot of loose fat and puffiness to the lower eyelids. This is actually one of the easiest operations that we do. It's got the quickest recovery. I literally do some doctors on Thursday and they go back to work on Monday. The sutures come out at day 2 and 5. The recovery is very quick. It can even be done under oral sedation. You don't even need to be put to sleep. So what we do is remove the excess skin, remove the excess fat, and the scar falls in the crease of your eyelid. So when you have your eyes open, the scar can't be seen at all. Sometimes you have a scar right underneath your eyelash lines and your lower eyelids. We're going to make sure that we tack the corners of your eyes up enough that you don't have any pull down to your lower eyelids. We don't want you to have it look like you've had any surgery, really. We just want to make you look refreshed. Most people are back to work in 5 to 7 days, and you look great in 2 weeks.
Problem with my eyes and exposure over the years and lost a lot of my peripheral vision. So I went to the ophthalmologist and they did peripheral vision tests, and I just wanted to have that corrected. And then while I was corrected, there was just other things that were done, just tweak things or lift things up around your eye level, just so you just don't feel or look so tired. Well, Savannah's blessed with many good physicians, and I've had patients over the years that have been to. I had one went to every single. Well, I say every single, but at least 7 plastic surgeons in Savannah, and just told me what they thought of the process and all of that. And then you see somebody have a procedure done and say, well, who did that? And it's just like looking at artwork. It's obvious after a while whose work is really, really good. Dr. Greco just is excellent. I told her the other day, I said, gosh, you can't even see your scars. That's like really, really good, because that's what people are concerned about, the scars. And then probably more important than that, when you get a result that people don't know you have plastic surgery, because people generally want that to be very private to them, and so you don't want to look like so different that it had. You just want to look better, and people can't really tell why you look better. He makes everyone feel very comfortable, and I think that's important too. If you have a physician-patient relationship, you want to feel comfortable that I'm going to do a good job, but that also that you're not that you'll speak with them and communicate with them. And then, of course, the process about just how it was all set up, there's no pressuring like you need this or you need that. It's more of like, this is available. So this is something you might consider, and then you consider it, and then they just take care of it.
Every employee knows that confidentiality is important, that great customer service is important, and we hire people who have that attitude, and we train them for their positions. Because of that, most people rave about their experience at our practice. Patient education is a very vital component of plastic surgery. The first thing you have to do is find patients and make sure that they have realistic expectations, and we can discuss what it actually is possible and what is not possible. We don't want them to go through a procedure and at the end say, geez, I thought I was going to be X, when that's not actually a possibility. You make your reputation by who you say no to, not who you say yes to. So there are certainly patients out there that are not good candidates for plastic surgery, and we have to find those and not operate on those patients. And then once we find people who do need our help, we try to help them in our best fashion, in the safest fashion possible.
I'll be 75 in June, and I was never ever somebody who wanted plastic surgery. I'm going to accept myself the way I am. You have to be beautiful inside. All the aphorisms, all the things that we've been told, and I really believe that I would take that path. You don't have to put up with the bags under your eyes and the wrinkles under your chin. You can improve on it. And one of the things he said to me is, your friends are not going to know I don't do the wind tunnel look. And I have friends who have that look, and I had no interest. But he promised and delivered, because people in general who know I had a facelift keep telling me that it doesn't look like you've had one. And then they will ask me if I had my hair done or something's different about you. And truly, people I haven't seen in a while, you look great. Life is going well for you, I guess. Did you get your hair done? And that's really nice to know too. I don't mind if people know I had a facelift. I had another friend. She went to somebody else. I talked to her at length, and she told me exactly that, what you just asked me. She said, remember, you're doing this for yourself, because you will be judged by other people. Some people will just say, well, I could never do that. I know that this is something that I wanted to do, and it's good to have that attitude, because it's not easy. I had a very supportive husband. He was kind of getting a kick out of the whole thing, actually.
So today we're going to talk about my approach to facial rejuvenation, specifically if you need to have a facelift. So the first thing we're going to do is we're going to evaluate you in my office. We're going to take and just sort of lift with our fingers gently and let you look in front of a mirror to see if that is the look that you're trying to achieve. We're going to take some photographs of you, and we're going to put it on a computer system called mirror imaging, and we're going to morph your photographs to show you what you might look like if you were to have a facelift.
There's nothing worse than being old, single, and divorced. So I figured, you know what? If I'm going to be divorced and single, I'm sure as heck going to look great. So Dr. Greco has done a couple of procedures, and the last one was my facelift. I feel like $1 million, and I play tennis with his wife, Robin, and I just think he's absolutely fabulous. I trust him with everything.
Once you decide this is something that you need, we're going to talk about what it means to go through surgery. You'll come in and the young ladies will give you some pills to make you groggy. We're going to put an IV in your arm. We're going to make you groggier. You're going to go back to the operating room after we've had an opportunity to talk about your goals again. And the operation is done under sedation. You're not actually put to sleep completely. You're not aware of what's going on, but you're actually, it's safer not to have a tube down in your throat, so you're breathing for yourself. The operation itself will take anywhere from 2 to 4 hours, depending upon what exact procedures we're going to do. When you wake up, you'll be in one of our recovery beds, and you're going to spend the night here where the nurses will take care of you for the next 24 hours.
His staff, by far, is the best. I mean, Miss Beverly is just one of the best. She's such a caring nurse, and they're just all the best that you can ask.
You're going to be sitting slightly upright in order to keep the swelling down. They'll be using some cool ice compresses to keep the swelling down from your face. And the following morning, you're going to go home, and you're going to have someone help take care of you for about 1 day. You'll then come back and visit us, and we're going to take out all your drains, and then you'll just have some suture lines. Now, I won't lie to you, you will swell up, and the worst swelling is between days 3 and 5. I tell all my patients you're achy, swollen, and say, why the heck did I ever do this? But by about day 6, you're going to know why. The swelling will start coming down, your new youthful appearance will start showing. At day 5, we're going to take out your sutures in front of your ears, and all your sutures around your eyes, if you have your eyes done, will be out. Usually by day 6 or 7, with sunglasses, you can go to the grocery store. Then usually by day 10, the swelling has gone down enough that you feel comfortable enough to go out to dinner with your spouse or go back to work with a little bit of makeup on.
I was outside. I went to dinner with friends after like a week.
And by 2 weeks, you're going to be ready to go to a cocktail party. By that time, we're going to have all your sutures and staples out, and you're going to look better than you did before surgery. Now, I will tell you, over the next 4 to 6 weeks, as all the rest of the swelling goes down, you're going to look even better. And at 3 months, you look better than you do at 2 weeks, because the scars will have settled down and the swelling will have been gone. And really at a year, the scars will almost become imperceptible, and that'll really be even the best time. Even without makeup, you're going to look great. So it does take time to recuperate from having a facelift. It does not hurt. If you have pain, there's something wrong. You will be swollen, it will be achy, and sometimes people are a little bit stiff or achy in the neck because we sew the muscles back to give you a really nice, smooth neck. But the operation itself, almost all my patients will tell you that it's nowhere near as bad as they thought it was going to be.
And mine's cleared up real quick. As a matter of fact, the doctor was amazed at how fast mine's healed.
So if it's something you're thinking about, you certainly can come. We'll be happy to talk to you about it. If you don't know anybody who's had a facelift, we can put you in contact with somebody who has, and they can tell you about their experience. It's important to feel very comfortable whenever you have elective surgery, and we're going to help you get there.
I ran into a friend, this woman that I was playing tennis against, and I played with again, several times. And one day she said to me, she was going to this to a school reunion, and she was getting, in shape, because I said to her, "Oh, you've lost a lot of weight, blah blah blah." She said, "Yeah, and I'm getting, because of this reunion." And I said, "Well, what year was it or whatever?" And she said, well, she told me the year, and then she said she was 72 or something. I said, "Are you kidding me?" She said, "Oh yes, I've had a facelift. Didn't you know?" And I said, "No." And so I said, "Well, who did it?" And she told me it was Dr. Greco. The funny thing was, I'm like coming in here and I'm thinking, okay, I'm just going to have like a little talk and, whatever. So when I finally got down to it, and I came with my husband, and we sat in his office together, and he said, "Well, what do you want to do?" And I said, "Well, you know what do you think I should do?" And he said, you want me to? And I said, yeah, what would you do? And he said, well, the first thing I would do is your neck. And I go, my neck? I said, I never even thought of my neck. I said, I just thought I needed a little lift in here. He said, no, he said, I do your neck. And then he said, I would do your, and the funny thing was one of my friends had said to me, have you ever had your neck done? And this was like before the surgery, so I didn't think, but now that it's done, it's like, oh my gosh, he's so right that I needed my neck done.
Today we're going to talk about cosmetic deformities of the neck. One of the most exciting operations I can do for young ladies is when they come in and they have a big neck, no real chin. And just doing some submental liposuction can redefine their entire chin neck region. This works really well because they have good, healthy skin that will snap back. As we get less young, people sometimes have loose skin, sometimes muscle bands, and sometimes extra fat. And so we have to address that through a combination of liposuction, direct excision of the fat, tightening the muscles either in the center or on the side, sometimes through a neck lift, and if it's part of facial aging in general, sometimes every facelift includes an improvement in the neck. Which is right for you will be determined about your actual physical findings. So if you have questions about your neck, please come visit us and we'll try to tell you what we can do to help you have a stronger neckline.
I've got a friend. He's very particular about his car. He had a car and kept it immaculate. And anything happened to it, he'd always fix it, kept it shining. But he had his teeth bad in front. And so I told my wife, I said, this fella, he cares more about his car than he does his face. And I said, that's not going to be the case with me. I said, if I can have my car painted when it gets rusty and bumps on it, I said, then I care a lot more about my face than I do my car. And that's what caused me to make my decision on it. Most of the time I don't feel 75. I try to keep busy, very active. My wife, she tried to talk me out of it because she said I didn't need it. She said, you look okay like you are. But if you want to get it done, go ahead, but I really don't think you need it. Well, I picked Dr. Draco because I did some research on him, and I saw his resume, his history. After checking him out, and I decided that he would be the one to do it and go ahead and get it done. There was a remarkable difference. The comments that I made, my relatives that I've not seen for a while, they all make comments about it, how well I look and how young I look and so forth. So I'm very pleased with it. I'd do it again.
I have an interesting story about a patient who she was getting ready to go to her 25th high school reunion, and she wanted to look as good as possible. She came in and she had some facial rejuvenation. She went to the reunion, and her and her girlfriends all sat there talking about A, how great she looked, but B, how this girl and that girl and this girl, all you can tell they've had facelifts. And no one could tell that my patient actually had any rejuvenation surgery. She never fessed up to it, but they all loved the way she looked, and they all could point out the bad facial rejuvenations that were done in the audience. She felt so good about the way she looked and the fact that none of her friends could tell that she had cosmetic surgery. Some people are very open about having had cosmetic surgery, and some people are very private about it. The important thing is, when you're done with surgery, you want to be able to not have to tell people or not have people know that you've had cosmetic surgery. If you want to tell them, you tell them, but they shouldn't be able to tell by looking at you. Today we're going to specifically talk about deep wrinkles around your lip and having a long upper lip. Those years of smoking and spending time out in the sun often will lead to actual creases around your mouth. Early on, we will tell you to try to prevent them by stopping smoking, avoiding exposure to the sun, and using things like Retin-A to help try to smooth out those appearances. In addition, we can use fillers to fill in those lines to try to give you a more smooth appearance. If those things aren't successful, there are procedures that we can do to resurface the entire perioral area. We can use chemical peels, laser, or dermabrasion. It's just like when you get a burn or a sunburn, the skin peels off and beneath it it's smoother and shinier. The same thing's true when we use these modalities. Result is great. Some people have a very long lip. As we get older, our lip grows and you can't even see your teeth anymore. And through a procedure called a lip lift, we can excise a segment of skin right on the upper aspect of your lip, and it's hidden beneath your nose, which will give you a poutier lip and again expose your pretty teeth. If you have problems with any of these things, please come visit us and we'll tell you what we can do to improve the wrinkles around your mouth.
The before and after shot, I didn't realize that I looked as bad as I did. My eyelids came down over my eyes and it gave me an angry look. And I had deep creases, right up in here. And I had the deep lines over the lips. And I also had a chin. I had lost about 50 pounds. And so I had no chin. It sort of came down like this, and it looked like draperies. And I wanted to see if we could do something about that.
The University of Pittsburgh has been for the last 25 years one of the top 3 plastic surgery programs in the country. And it creates many of the other program chairmen. And it was really my first choice of where to train.
My dad was a general and thoracic surgeon, and I started operating with him when I was 12 years old. And I always thought I was going to be a cardiothoracic surgeon. And when I was in medical school, my sister actually had an operation, and she went from the most quiet introvert to the most outgoing extrovert. So I said to my dad, what happened? And he said she had a breast augmentation. And it was amazing to me that I realized that an operation can totally change the way a person perceives himself. And so I thought, well, I'm going to look into this. So when I was in medical school, I did a 1-month rotation at Stanford University out in California in plastic surgery, and I did a 1-month rotation with one of the best heart surgeons in the world at Jefferson in Philadelphia. And at the end of it, I realized that plastic surgery allows me to look at each problem and create a new solution. You have to use artistry, you have to use your knowledge and your skills to get the result you want. And so every day is a new exciting day, and that's why I became a plastic surgeon. Today we're going to talk about some of my secrets to help you age gracefully. It starts with eating the right kinds of food, getting 6 to 8 hours of sleep, trying to avoid intense sun between 11 and 3, using sunblock when you have to be out in the sun, not smoking, not doing drugs, trying not to go to sleep with harsh makeup on your face, taking antioxidants. All those things are components of allowing you to age gracefully. In addition, many patients will come see me, and over the years we will look at how they begin to age. We will add things like skincare, the use of topical Retin-A and the skincare program Obagi to make your pores tighter, get rid of the fine wrinkles, and give you a more even tone. We're going to talk about using Botox when you start getting little wrinkles so we can prevent deep creases. We may use fillers to fill in deep lines as they come. There'll be a day when you might need surgery. The first area might be around your eyes. There are creams that we can use around your eyes to help increase your elasticity. That prevents when you need to have your lower eyelids done. But when the time comes that you do need to have surgery, we can talk about the fastest recovery, the easiest surgery, and how to get the best result. Over time, you may start noticing some sags to your nasolabial folds, to your jowls, to your neck, and we will address those when it's appropriate. We will talk about whether it's better to do these things together or individually. It really is going to depend upon the pace that you want to maintain and look as good as you feel.
I have no scars. I know that they warn you always about things that could go wrong. They have to do that, but they say you can expect to ever pull your hair back in a ponytail for all the scars behind your ears, but I always wear my hair in a ponytail, so I can't say, I can't say that's true. Greco's just such a professional, and his ability to prevent the scarring is just astronomical. I mean, he is just the best. I don't have any scars that I can see at all. And they know exactly who you are. Even after 9 years, they just know who you are and how you do it. In 2 days, and no big deal, and 2 weeks later, you're out at the gym.
So why is there such an explosion of interest in facial aesthetic surgery? Well, in the 60s, when they invented Social Security, what percentage of the country lived past 65? 1%. Today, the average age that we live to is 78. And more people are living into their 80s and 90s. And not only are they living into their 80s and 90s, they're still enjoying life. They're active, they're dancing, they're playing golf. They want to enjoy life. Medicine has helped people live longer. Unfortunately, we've not found ways to make people look as young as they feel. And so people are, especially men, we used to live to about 65 or 66, and we grew to become distinguished. Now we're living into our 70s and we're getting old looking. And so there's a rejuvenation desire by these young at heart men who want to enjoy life. And so the question is, what can we do to help them? And that's what facial rejuvenation, surgery, and procedures are all about. Allowing people to enjoy the next 20 years of their life so that they could look and feel as young as they actually feel.
I met Dr. Greco about 5 years ago, and probably even longer than that. Talking to Dr. Greco, my main concern at the time was that my eyes started to droop on the sides and started to take a little bit of my sight away. And while we were talking, I felt so comfortable with him and what he was explaining to me what to expect and what the recovery time was. We started talking about something on my neck, below my eyes, above my eyes, my forehead, and we just decided to do the whole entire facelift. I started to look a little old, and I just didn't feel old on the inside. I just looked old on the outside, and I have a younger wife. She has to look at me all the time, so I want to make sure that we kind of match. It was, you should really do it, honey.
So after you've watched these patient testimonials, you may say to yourself, what is the next step? The next step is to go to our website, www.aginggracefully.md. Look at the different before and after photographs. Watch some of the videos to see what exactly is our approach to the areas that bother you. If you decide you want to come visit us, remember, education is easy. Many patients come in saying they think they need to have a complete facelift. They think we're going to do their brows, their eyes, their nose, their neck. And the answer is most patients don't need everything. Often, small areas of improvement will make a big difference. And sometimes it just takes some injections with Botox or fillers. Other patients require more advanced surgery. It may be that your eyelids are looking a little bit old and we need to make them look younger. It could be that you need a little bit of a lift to your cheeks. Some patients do need everything, but they're not the majority of our patients. And so coming in and just finding out what would it take to help you look and feel as good as you feel today is very simple. We look forward to meeting you and talking with you about your difficulties.